elevation by 3 millimeters in leads V4, V5, and V6.
ShandsCair is the critical care transport program for the University of Florida, Shands Healthcare. We've been established now for 30 years. We provide all different types of transport, several different modes, including fixed wing, helicopter, and ambulance. And we're very fortunate that we actually build our medical teams for our patients.
ShandsCair is a unique organization, and then it provides such a wide variety of care to patients.
So ShandsCair provides probably the highest level of support in the area. We were the first program in the state of Florida to actually transport with nitric oxide, and we're one of the only programs in the country that actually transports with active hypothermia.
ShandsCair 1 operates an Augusta 109 power helicopter, which is certified for a single pilot IFR flight. And basically what that means is it allows the helicopter to operate in instrument conditions or flying in the clouds or areas of inclement weather. It's unique to the area. There's only several here in the southeastern United States that are actually able to do operations such as this. And it allows us to expand our operations in areas where other helicopters may not be able to fly.
Since the start of ShandsCair, we've transported approximately 45,000 patients. We average approximately 700 helicopter flights a year. That was with only one helicopter program at the time, so we anticipated a growth in that volume. We average approximately 115 fixed-wing flights a year and over 1,400 ground transports a year.
Good copy, Rescue 11. No questions, and we'll see you in the South Tower momentarily.
The ShandsCair Communication Center, basically because of our dynamicness with the fixed wing, with the helicopters, and with the ambulances. There's a lot of communication centers that do not have all those responsibilities. And so not only do we take rescue reports from incoming rescues going to the hospital, we also have the fixed wing that we monitor, the helicopter and the ambulances, as well as paging out all the alerts that come into the hospital and internally inside the hospital.
ShandsCair is really an extension of the hospital facilities. All of our protocols are driven from UF physicians, and so the moment that ShandsCair clinicians get to the bedside to take care of the patient, we're actually able to deliver care that is formulated by UF physicians.
As medical director of the neonatal pediatric flight team, my role is to oversee the direction of the team and also provide medical protocols for the team. Our team is a protocol-driven team, so when they actually go out in the field, they're carrying prefabbed orders that enable them to care for the sickest neonates across the state.
I've been doing this for 20 years, and this is a job that has not become monotonous at all. Every time the pager goes off or every time the radio goes off, you know, it's just knowing that anything can happen. I like to think that fighting against death sometimes, and that's the most competitive thing you can fight.
ShandsCair is like a family. The teams are not just people that are working together during their shift as a team, but the friendships and camaraderie extends way beyond the walls of this building.
One patient at a time, yes sir, that's correct.
ShandsCair's family atmosphere transitions into the community where you can see the dedication that each employee has and their job responsibilities, how they approach patient care, even down to individual commitment levels from individual team members into the community. It all works together as a team, and we take that team concept out into the community.
I think ShandsCair is different from other flight programs, most importantly because of the quality and the special people who work here and who are dedicated to providing the care that they do.
Back in 2001, I was in a bad motor vehicle accident and was actually flown by ShandsCair. The guys that took care of me just were incredible. At the time, I didn't know what path I was going to go, what I wanted to do, and after my experience with ShandsCair, it just kind of changed my life. Doing this, you know, makes me feel like I'm giving back, and actually, you know, when I come to work, I hope that I can be that person for somebody else that's been in a bad accident.
I was here in the mid 80s and flew with ShandsCair until the 90s. I left for a while and then found myself coming back. So when you have a chance to do such an important and fun job twice in your life, you kind of figure that maybe this is your home.
for people to care the amount that these people have cared is extremely unusual, especially in this profession. In this profession, you learn to be guarded against people, because if not, you're going to get hurt. And thankfully, they haven't learned that yet. So, I mean, that's a really good thing, because you don't perform CPR on somebody for 5 minutes and stand around watching to see if he makes it through the next hour. And you don't come back every time you're at the hospital and see that he's okay. And they do. You know, it's really great. Yeah.
You should call ShandsCair, because we're going to treat you like you belong to us, like you're one of our family members.